Hello guys, welcome back to another video. In today's video we are going to talk about causes of failure of hormonal contraceptive. Most people usually say that I was using this type of pills, or I was using hormonal contraceptive and I got pregnant, so I don't trust this hormonal contraceptive. Most of these hormonal contraceptive, or let me say just contraceptive as a whole, usually have some little kind of error. They are not 100% effective, and therefore this error, if you don't avoid them, then you will get pregnant without knowing, or you will get pregnant the time you are not prepared for. So therefore I will like to tell you that you like this video, you share, you comment, and you subscribe to this channel, because you are going to miss a lot if you don't subscribe and share our content. So don't forget also to turn your notification bell, because every time we post a video you will be the first person to be notified. So let's get into the video. Number one is about the human area. For example, if you are using pills, you're supposed to take that pill at the same time every day to get a maximum protection. If you are, for example, if you are using a pill and you have decided you are going to take this pill at around 8 a.m. or 8 p.m., then that is the time you're supposed to take it every day for you to get a maximum protection. And again, another thing about the human error, when you are getting the depot, for example, depot usually, when you are, for example, when you have gotten your injection, or you got your injection last month, maybe date 6, let's say, for example, then the next month when you are supposed to get the next injection, you are supposed to come on at around the 4 or the 3. That is when you will get a maximum protection. And also when you are using Gedel or Implanon, it usually starts being effective at around after 7 days. Then when maybe the healthcare provider forgot to tell you that you should have protected intercourse for about 7 days, or you should abstain, then you can get pregnant at around that time. So human error can cause failure of can cause failure of hormonal contraceptive. Number 2, improper storage. Avoid putting your medicine at places where temperature can be high at some point and can be low. Put your medicine at maybe an open place or in cool location where there is a room temperature, where the temperature will not fluctuate most of the time, because when the temperature is high or it's low, it's interfere with effectiveness of birth control or hormonal contraceptive, especially pills. The third point is when you are using other medication. For example, if you are using some antibiotics, if you are using antiviral HIV medication, if you're using some antifungal, if you're using anti-TB, if you're having a mental disorder and you're using mood stabilizer, then this medication can interfere with effectiveness of hormonal contraceptive. Therefore, before you start taking this medication, then you should consult with your doctor, and your doctor should advise you on the proper or about the right hormonal contraceptive that you can use during that time when you are taking this medication that I've mentioned. The fourth point is certain illness. Any acute illness or any chronic condition that prevent your body from fully absorbing birth control pills can put you at a higher risk of getting pregnant when you don't want. So if you have any condition that can prevent your body from fully absorbing the medication, then you are putting yourself at high risk, or you're supposed to just avoid using any or hormonal contraceptive. Or maybe, for example, if you take medication and then you vomit after taking 2 hours after taking this medication, then you will not get an effective the medication will not be effective, because sometimes it has not been absorbed in your bloodstream well. So any certain illness that put you at those risks, then you should not use hormonal contraceptive, because you will not get maximum protection. The fifth point and the last one is obesity. So obesity, having a higher body weight, can affect the rate at which you metabolize your birth control pills, and therefore this can interfere with effectiveness of the birth control or this hormonal contraceptive, and therefore you will not get maximum protection of pregnancy. So if the first point is human error, obesity, if you're using other medication, and about the storage, all these factors can cause failure of hormonal contraceptive. So I think I've reached the end of this video. Thank you for watching. Thank you for tuning in. Let's meet in the next video, or bye till next time.